Welcome, Dr. Aanchal. In today's episode, we're thrilled to have a renowned dermatologist, passionate skin educator, and the myth buster. She has helped countless individuals decode their skin's needs.
Cosmetology is not a degree. It's a very loose term that is used by anybody who has interest in skin. Actual degree is dermatology.
One skincare product you can't live without.
Moisturizer. Have very dry skin.
More the water you drink, the better your skin is. Is it a myth or is it just another fad?
It's a myth. 2 to 2.5 liters of water, 3 liters is more than enough. Drinking like 4, 5, 6 liters is not going to add anything other than spending a lot of time in the washroom.
From this, can we have water? If 10 patients are coming to your clinic, how many of them ask about Korean skincare?
Oh, people love Korean skincare and there's a reason behind it. Koreans have cracked the code of customer satisfaction. People tend to feel if they use Korean products, they'll get skin like how Koreans have it. It doesn't happen like that.
But do you think that Korean products as it is are formulated for Indian skin and health?
Oral collagen a scam, or does it work?
I really don't believe in collagen supplements at all. I feel that much can be achieved with just using a good moisturizer and taking a high protein diet.
What's your take on retinol?
I love retinol. A lot of people feel that retinol has to be used every day, something that you are going to use lifelong. So there's no point being over enthusiastic about retinol.
What is the easiest skincare routine for college and office days?
This is for boys, men. Just use a cleanser in the morning and use a sunscreen. You're good to go. Evening you'll cleanse and use a moisturizer. That's it.
What's your advice for those looking to see results? Welcome to Get Personal with Personal Touch Skincare, our very first episode for everything skin. In today's episode, we're thrilled to have a renowned dermatologist, passionate skin educator, and the ultimate myth buster. With her science-backed approach and practical advice, she has helped countless individuals decode their skin's need. Get ready for an enlightening conversation filled with expert tips, demystified skincare myths, and a touch of fun. Welcome, Dr. Aanchal.
Hello, thank
Hello,
you.
how are you?
I'm good.
Dr. Aanchal, tell us a little bit about yourself.
So I'm a dermatologist and a hair transplant surgeon. I have been practicing dermatology since the last 10 to 11 years in Surat, Gujarat.
Okay.
I finished my MD from AIIMS, New Delhi. And my main areas of interest are hair transplant and cosmetic dermatology as well as core dermatology.
That's amazing. So you've been to Delhi before.
Oh yes, I've stayed here for
You
5
stayed
years.
here. Oh,
That's
amazing.
right.
So I would like to ask you one question that is, I think, a very common question amongst all the audience we have. That what's the difference between a dermatologist and a cosmetologist?
So this is a little controversial, but I have to put this out. So
Yeah.
cosmetology is not actually a degree.
Okay.
So it's a very loose term that is used by anybody who has even like little interest in skin or wants to practice skin. Actual degree is dermatology. It's an MD course which is 3 years of training, wherein we see inpatients. I have an OPD. We admit patients and study skin and skin diseases in detail. So there's only one degree, that is dermatology. But a lot of people do these crash courses and certification and call themselves cosmetologists, but that's not actually a real
what
degree.
do
So
they
it's
learn?
usually cosmetic dermatology or aesthetic dermatology. These are dermatologists who practice a certain field of cosmetic or aesthetic. We usually prefer the term aesthetic dermatology. So that is what it is. So nowadays everybody's calling themselves skincare expert, certified skin expert, but there's no actual recognized MCI recognized degree in cosmetology or any kind of medical license or a degree in skin expert.
But
There's
if you're
nothing
a
like that.
cosmetologist, for example, if they've done a crash course, how does it help them personally? Just the description that they've done this, or does it give them any right to perform any proper, be it a surgery or an
No,
implant?
so surgeries, of course, doesn't give you any right. So see, a lot of people who have done MBBS and then do a crash course. So in MBBS, you do learn, basics of how to take care of a patient and everything, and then they take a course and then start practicing cosmetology usually. Otherwise, if anybody without an MBBS is calling themselves cosmetologists, then I would say that is like really wrong thing
Got
to
it.
do.
I think that's also like fooling the audience for something.
Yeah, because
not-
there, like you said, there's no clarity in this
Yeah.
term, and because there is no real certification and no kind of they are not held accountable for using
Accountable
this
for-
term, so that's why it's used so widely.
And I see this so often, like we see so many people DMing us about the skin issues they have, but they go to these skin experts, you can say, or these cosmetologists who have done all these crash courses, and then they end up burning their skin, or they end up spoiling their skin. So then they come up to us that we want to get rid of this burnt skin or something, but that cannot be undone when they've gone to someone who's not like properly
Correct.
professionally.
Yeah, so I always tell patients, look for the degree, understand what they
Exactly.
have studied. It has to be an MBBS MD. If you
Right.
are having any skin concerns, they are the right people to consult.
And how do you think the audience should choose their dermatologist? Like, how do they build the trust with them?
So first has to be MBBS and MD, DNB or DVD. Okay, so any of these degrees, and building trust, it takes time.
Yeah.
Finding a dermatologist that suits you, your requirements, and what you are expecting from a doctor takes a little bit of time to kind of find the perfect one.
Right.
Because sometimes the way a doctor approaches, you might like it, might not like it. So there's no like black and white in that. Like how we have different general practitioners, family physicians that we say family completely trusts them. It has taken years of trust building for that doctor to be seeing the patients and the family members regularly, so that they feel so comfortable going there for every little ailment. So same with a dermatologist, so it'll take a little bit of time. But now that we have social media presence, you can definitely find them online or through referrals. Of course, if somebody has visited,
Word of mouth.
yeah, that is the most trustworthy. But always look for MBBS, MD, DNB or DVD degree, as they are the ones who are actually qualified to treat your skin.
Treat your skin.
I
And
see
I think,
sometimes any physicians also recommending clindamycin like anything.
So
Just
see,
apply.
yeah, so physicians, okay, in the sense that, see, sometimes what happens is, even when I do get patients, they tell me like, oh, I'm having back pain, can you write medication for that? But I tell them, no, I'm not an expert, even though I have done MBBS and I can write, but I feel that I might give them relief for a short period of time, but we are not finding the cause, and there has to be a proper detailed investigation, even if it is something as common as back pain or slight back pain. So always directing them to the real expert is the best thing to do. And I do understand where the physicians are coming from. Sometimes a patient will be like, just write a moisturizer, or just I get occasional acne, please write a cream. For them it might be like, okay, then I might just mention one or two creams to help them. So that is still okay, because they have that basic knowledge of antibacterial resistance, or basic knowledge of what should be done and should not be done. And I'm sure when they feel that an expert has to be involved, they do refer.
Got it.
absolutely right. And I think one has to have that trust in their dermats wherever they're going, because skin is something everybody is concerned about these
But
Yes.
I
days.
also think this is a major concern in the market would be like every brand is claiming to give a 7-day or a 10-day change, which has just might have caused a lot of problem for a dermat to take them through the whole skincare journey, because their expectation bar has gone so high that they're expecting a 360-degree change into their skin within 7 to 10 days, which is impossible to have.
Absolutely. That's why, all of us dermatologists on social media are continuously trying to educate people into understanding that good skin takes patience. It's a consistent routine you need to follow. There is no magical ingredient. Everybody's searching for that one ingredient that will change or transform their skin. There's nothing like that. If it was out there, everybody would know about it.
And a lot of healthy diet, I feel. A
Yeah,
lot of
healthy diet, a good lifestyle,
Yeah.
avoiding stress, sleeping well, all that is important. And also understanding that there is no quick fix.
Yeah.
Everybody is looking for quick fix. You have an acne, you feel that, what can I apply that it will settle in 24 hours? Or what can I do that it will go away completely in 1-2 weeks. It's not like that. Whenever we make a regime, we have to make sure that we follow it for 4 to 6 weeks. So that's what I also tell my patients when they come to me, refer from other doctors, or when they have just come after showing some dermatologist, like, I use it for 2 weeks, but I didn't see results. 2 weeks is just too
It's
early.
too
You have
less.
to give it at
Yes.
least 6 to 8 weeks in order
At
to
least
see improvement.
settle the
Yeah, for
product,
the-
whichever it might be.
Before that, we don't know whether the product actually worked on you or not. Of course, if it made things worse, or if it caused a reaction or something like that, then we should stop and change. Otherwise, in order to see results, you have to let it work for
So
4
in
to 6
personal
weeks.
touch also, in the whatever study or whatever ingredient study we have done, we always tell our audience, our customers also, to wait for at least 2 months. Give us 40-45 days at least for the product to work.
Correct.
And you will see the difference, even if it's not like the proper difference you need, but they will see something at least in 45 to 40 days.
Yeah.
Skin.
So see, if you're looking at a cleanser, that obviously cleanses immediately.
Cleanses,
If you're
yes.
using a moisturizer, that also should make your skin feel better immediately.
Right.
But when you go to serum or any kind of
Serums, right.
corrective agent, which is working at a slightly deeper level, which is not just trying to hydrate or moisturize your skin, then we have to give it at least 6 to 8 weeks to see results.
True. Absolutely. So we have a few questions to ask you.
Okay, so let's start with what is the easiest skincare routine for college and office days?
Okay, so I have 2 routines. Okay, one is super simple for people who don't want to invest more than 5 minutes in their skin, and one who want to invest slightly more time in their skin than that. Okay, so first is the super easy one. Just use a cleanser in the morning and use a sunscreen. You're good to go. Evening you'll cleanse and use a moisturizer. That's it. Okay, start with this basics first.
Like
Boys
then
would
we'll
love
do
it.
the-
Yeah. So this is for boys, men, who don't want to
Yeah.
invest too much of time. The second one is use a cleanser in the morning. Use an antioxidant serum, which will help in improving your dark spots.
If you
Also,
could just take a few name of the ingredients,
Yeah.
it will help the
so in the
audience.
morning, in that serum, look for ingredients like vitamin C or niacinamide, even azelaic acid, alpha-arbutin, kojic acid, one of that, and then use a sunscreen. That's it. If you have dry skin, you can use a moisturizer in the middle. If you don't want to layer too many products, use a sunscreen which is moisturizing, meant for dry skin. Okay, your morning routine is done. At night time, cleanse your face properly. You can use a retinol and then use a moisturizer. We usually prefer retinol after age of 25.
Yeah,
Okay,
I was
if you're
about
below the age of 25, like you said, college going, then you can use the same serum that you used in the morning again at night, and make sure to use a good layer of moisturizer, especially if you have dry skin and even if you have oily skin. So a lot of people with oily skin feel that they don't require a moisturizer. Your skin is already making a lot of oil. When you get up in the morning, your skin looks very oily. We don't want to deprive your skin of a layer of moisturizer. So use the correct one. Use something with ceramides, hyaluronic acid, which does not feel very oily or sticky but still does the job. We have to understand that in oily skin, if you're not using a moisturizer and using these drying cleansers, it makes your skin produce more oil. And that just makes your skin even more acne prone. Okay, so using a light gel based moisturizer is
And what about
paramount.
if you're oily but also having an active acne?
Then some ingredient like a salicylic acid or niacinamide
The oil
or
control
prescription based creams can help in reducing acne.
Got it. And is sunscreen really helpful or just a waste of money?
It's very, very helpful, not a waste of money at all. We have enough data to prove that sunscreen are very beneficial. They help in reducing your dark spots, slows the process of aging, and overall a good product to include, a mandatory product to include in your skincare routine. And sunscreen is not only for reducing dark spots and slowing the process of aging, it also helps in recovery of any kind of dark spots that you would have on your skin. So because our skin is so prone to develop dark spots and we have so much melanin in our skin, any type of injury can heal with a dark spot, whether it's an insect bite or you've just scratched your skin, or sometimes even dryness on the skin can heal with dark spots. So using a sunscreen can help in improving that, reducing the formation of dark spots, and also reduces melasma, which is commonly seen in our skin type. So makes your skin tone more even, reduces tanning. So sunscreen is an absolute must.
And
That's
how
why I
does-
included it in the morning routine.
How does one choose their sunscreen according to their skin types? Like if we talk about personal touch, we offer 3 types of sunscreens. That's one that matte, then there's Sunstalker, and there's one with mucin in it, mucin SPF. So every texture we have worked on is different to other one. So how does one choose their texture for acne prone skin and oily skin type
Mainly,
and
the
dry?
main concern would be identifying for a layman person. It's so difficult to identify their exact skin type. When they come to you, you would understand. But if a person watching this or going through and consuming a lot of content available online, how do they identify their skin type in general?
Okay. So first I'll answer that, like how to identify skin type, and then how
Yes.
to choose a sunscreen according to
Yes.
your skin type. So the best way to identify what type of skin you have is use a gentle cleanser in the morning and then let your skin dry normally for an hour. After an hour, just examine your skin. You can even use a tissue paper. Okay. So if you feel that your skin is oily, it's looking too shiny, and when you dab a tissue paper on your face, you can see like blotching of oil on that tissue paper. That means your skin is on the oily side. If you feel that there's oiliness but only on the T-zone area, then you have combination skin type. If you feel that there is few specks of oil, not too significant, then you have a normal skin type. If you feel your skin is completely dry with no oily patches, then you have a dry skin type. If you feel your skin is red, irritated, itchy, or you feel like a little bit of burning or stinging sensation on your skin, then it means you have a sensitive skin type. So you have to choose a sunscreen accordingly. Okay. So now you know the skin type. For oily and combination skin, I usually prefer to use a gel-based sunscreen. Like you said, a matte finish sunscreen is something that you can prefer because that will not make your face look very shiny and oily throughout the day. For a dry skin type, it's better to look for moisturizing ingredients in the sunscreen, something with mostly a lotion or a cream formulation. So we look at formulation as well as the ingredients. Okay, so that is how you choose. For normal and to dry skin type, you can use either a lotion or a cream base. Here also there's a catch. A lot of people, even if they have dry skin, don't like a very heavy sunscreen. They
That's
still
what.
like to use either a matte or a
Water-based.
gel
Yeah.
sunscreen. So for that case, what you can do is, like in the morning after the serum, apply a layer of moisturizer that you like, a light moisturizer, and then go ahead and apply a layer of sunscreen, maybe a gel-based sunscreen.
Yeah.
So even though we say gel-based sunscreen is better for oily skin type or combination skin type, a lot of my dry skin patients love using gel-based sunscreens because even though they have dry skin, they don't want something heavy on the
A
skin.
layer putting up.
Yeah, and gel-based sunscreens are formulated in such a way that they spread very easily. They don't feel heavy or sticky on the skin. Also, they mostly have chemical filters which don't leave behind a white cast
Yeah.
and also feels nicer.
Correct.
So that is one. And for sensitive skin type, if you are pregnant or if you want to use something for children below 12 years of age, then go for a plain zinc oxide. It's a mineral-based sunscreen.
Yeah.
So it usually has a zinc oxide or a titanium dioxide. So you want to use a plain mineral sunscreen. The problem with mineral sunscreen is it will leave
Yeah,
behind
it
a
will
white
give a
cast.
white cast.
It will.
Absolutely.
It will. But the white cast does get better in about 5 minutes. So just wait for it. Slight white cast, you will have to accept it. You can use a little bit of, compact. So you can use a little bit of compact powder over it, or use a tinted sunscreen over it to reduce the amount of
White
white cast that is left behind. But in sensitive skin type patients, best to use a mineral
But
sunscreen.
following up to this, I was going through a study globally also, the mineral and the chemical fight always happening. There are a lot of big names backing that there is no concrete proof. There's just a study on 25 to 30 people proving that chemical sunscreen is harmful than a physical sunscreen. But we would like you to tell us that both of them are good, but in what sense and how
Like
good
the pros and cons of
the
Understood.
differentiation
Yes.
between.
Yeah. So basically, there is a US FDA now, that has come up with a guideline that chemical sunscreens are not harmful at all. Yes, they
Correct.
are present in the bloodstream within 30 minutes of application, but the levels are so low that they do not cause any harm. So that is out of the window, that all the sunscreens are properly tested and there is no kind of harm that can be caused. So still, if you want to be extra careful, you can maybe avoid a few ingredients, but otherwise overall chemical filters are also very safe. What I prefer in most of my patients are hybrid sunscreen, wherein you have zinc oxide and titanium dioxide along with chemical filters. Why is that important? Is because in India there's also a lot of dust and pollution. So a little bit of presence of zinc and titanium kind of forms a layer on the skin, so it gives a physical protection also to the skin.
Correct.
You know, and there was this kind of misinformation even within the medical community, where we felt that mineral sunscreens reflect light and chemical absorb and convert it into heat.
Correct.
But mineral sunscreens also absorb and convert it into heat, so it's not like just reflection. So this is important to understand. So I think presence of either zinc or titanium dioxide helps in making the sunscreen also protect you against pollution, dust particles,
Correct.
which could be irritating your skin.
And do you think these, I don't know if this is a fad or it's really a thing, but are spray sunscreens good enough for the skin?
No.
Yeah.
So spray sunscreens, yes, you can use it on large body parts, which is difficult to apply. if
Like
you-
legs and
yes, and
arms.
when you are in a beach or you are expecting sun exposure for a short period of time, then spray sunscreens make it very easy to use. Even on kids, it's easier to
Yeah.
use a spray sunscreen, but you have to be very, very careful to not spray it around the
Mouth.
face, around the
A
mouth
lot of
and
brands
nose.
are promoting, and I read a study where the fumes go in. You inhale the fumes
Yes,
when
so
you
it
put
has
it on
to,
the face.
even if you do want to use, let's say you have only one sunscreen with you, which is a spray sunscreen, spray it on your hands,
Then dab.
palms, then you
Yeah.
can use it on your face. Don't spray it directly around your face. Absolutely not, because aerosols will be inhaled and it can be problematic. So it's good for the body for large surface area. I usually prefer spray sunscreens for, reapplication purpose. So let's say you apply a lotion once, and then if you want to reapply, then use a spray. I have the same, thought about the stick sunscreens as well.
I was
Correct.
about
You
to
cannot
ask you
depend
this,
on
yes.
just stick
Stick
sunscreen to
sunscreens.
But
provide
the
complete
main
protection.
thing is, I feel, see, I have OCD, so I can't just keep opening and putting up. Like
Yeah.
I've got dust on my face, and now I can't open the stick and reapply and keep it back like that. So
Correct.
it is exposure to a lot
Yeah.
of
Chemical,
environment.
yeah.
So
around.
how
Dust.
these stick sunscreens work is, they just forms a layer.
Yeah.
Correct.
And then it's clean again in the sense that it just forms a layer and leaves it. But stick sunscreen also is only a good reapplicator. Like for reapplication of sunscreen, it's good. You apply a layer of cream or a lotion based sunscreen that you usually use, and when you're on the go, rather than not applying any sunscreen, if you are out and about, applying a stick sunscreen is better. Now, rather than not using any sunscreen. So that is when it comes into play, when you have
But
to reapply
my
it.
point is, if you're going out, you have been exposed to a lot of dust. You've done your skincare. You have had sunscreen as the last step. Now you went out, maybe in a dusty area or somewhere, and taking out the sunscreen, be it a normal anything,
Any
be it a
sunscreen,
moisturizer
yeah.
or anything, on top of the dust you're putting up. I want to explain that because I personally never get the logic of reapplication after the dust is exposed to your skin.
Yeah, then it doesn't make sense, because then those gritty particles, you're just trying to like
Yeah,
seal it
that's-
into
And
your
then
skin.
this causes sensitivity,
Yeah.
which
So in that
customers
case,
complain.
if you are going to such a dusty environment that you feel that there's dust stuck on the skin, then best to wash your face and then apply, or use maybe like a wipe and then apply it. That is also, not the best thing to do. But I would still suggest that, yeah, if you are out and open, then it's better to just use one layer of sunscreen and maybe wash and then use another layer. Otherwise, on a day-to-day basis, we are not exposed to that amount of dust that we have to worry about washing your face again. Then you can go ahead and reapply it just as is.
And
Not a
what do you suggest to the girls who like to reapply a lot of sunscreen even after the makeup is done? Is it like good for the skin, or is
It is very difficult to reapply sunscreen in a proper layer without disturbing your makeup.
Exactly.
Okay, so if you have a lot of makeup on,
Yeah.
I would say that just use a good layer of sunscreen
Before
first,
that.
and then use makeup on
Yeah.
top. To reapply sunscreen without disturbing your makeup at all is very difficult.
Yeah.
If you are out and about in a way that you feel you are exposed to a lot of sun, then apply a layer of sunscreen which will disturb your makeup. Then maybe you can just apply a little bit of blush and a corrector, a concealer, and areas which you want to conceal.
Because I
Or
see-
use a tinted sunscreen which will
Yeah.
also give you a little bit of coverage. So that is the best way to go.
I see a lot of marketing gimmicks that these brands do, and they tell them ki your sunscreen will be very invisible to the makeup and it will set the makeup. They're providing sunscreen sprays for setting sprays, for setting the makeup, and then you reapply the sunscreen in that way. But that I feel is very harmful to the skin.
More than harmful. See, you have to understand that there are two things: either you don't use sunscreen at all, or you reapply sunscreen. So we have to look at it like that.
Yeah.
So is it better to reapply with a spray rather than not use at all? Yes, it's better to reapply with a spray, but not directly on the face. Like we said, you can first put it on the palm and then use it. Is it better to use like a proper sunscreen over a spray or a stick sunscreen? Obviously, it's better to use like a gel or a cream over a stick or a
Right.
spray. But then it's better to use stick or a spray than nothing at all.
Yeah.
So
Correct.
everything has a
Got
space.
the-
You just need to understand when and how to utilize it.
So all in all, you are saying sunscreen is very important.
Absolutely
be it
important.
Any form.
Yes.
Stick is also okay if they're not applying at all. Like for the guys, it's
Yes, anything that you like.
Yeah.
So when I get asked, which is the best sunscreen, I always tell them the best sunscreen is the one that you use.
Yeah.
The one that is not in the bottle and is on your skin. That is the best sunscreen. Okay. So as long as you use a sunscreen regularly and in proper quantity, that's the best sunscreen.
that's a very
Which
nice
whenever
way
you
to
like.
put it. That's,
is the
that's a
best.
very nice
Just
way
apply.
to put it.
Yeah, just
because,
apply it.
if I tell you Sunstalker, if you talk about it, Sunstalker, we made it keeping men in mind, because they are so like on the go always, or in the hurry, and we just wanted them to have a solution जिसमें moisturizer भी हो, serum भी हो, and SPF भी हो, and they're just good to go after
Similarly,
the
as
cleanser.
she had mentioned the moisturizing sunscreen for the dry
Correct.
and combination, and we added a radiance ingredient, Claire Blanche, into it so that it can work as a serum moisturizer and an
Yeah,
SPF.
so for people who don't want to layer too many products,
Yeah.
you are getting a sunscreen which
Exactly.
is also moisturizing.
Specifically for the boys, because
Yeah.
we hardly can wait for more than
Correct.
5 minutes.
Yeah, and that this is also one of the problems that I have with so much of fear mongering that happens on social media. While trying to fear monger about a certain ingredient in the sunscreen, and that ingredient is usually present in most of the sunscreens
Correct.
out there, which are reasonably priced. So people stop using sunscreen because they want to avoid that ingredient completely. But actually, using a sunscreen is much more important and much more likely to give you the benefits than avoiding it completely, and the risk of using that ingredient. So that's why we need to understand where it's coming from. Of course, we need to guide. If you have a choice, you make the better choice. But using a sunscreen is very
Better
much
than the
better.
bare skin.
Yeah.
And now the most hyped question: if 10 patients are coming to your clinic, how many of them ask about Korean skincare? What's the hype around it?
Oh, people love Korean skincare, and there's a reason behind it. So, see, Koreans have cracked the code of customer satisfaction. They know what people are looking for, what will instantly make them like the product. They know that. And also, people tend to feel that, if they use Korean products, they'll get skin like how Koreans have it.
Yeah.
Not the color, of course, but, the kind of reflection
Texture.
that they have. It's very smooth. Doesn't happen like that.
True.
Where Korean products, of course, scores is, firstly, Korean value their skin a lot. Okay, so there is a huge market for Korean beauty products in Korea and all over the world. So there is a lot of research being done every single day, and they come up with new ingredients very often. So because there is so much of R&D that goes into it, they are usually very innovative with products. So
Correct.
that is why also it's very popular. One of the reasons why Korean beauty products are popular is because the ingredients are very soothing on the skin. They use ingredients which help in reducing redness, irritation. They instantly plump up the skin. They are moisturizing. So they are loved by people with dry skin and with sensitive skin. What happens with products that are available in India, at least the older ones, let's say, 10 years back, they used to have a lot of fragrance and they used to be very thick. So people with sensitive skin had nowhere to go. They used to feel that, no, whatever I use on my skin, I'm going to react, so let me not use anything. People who have acne-prone skin, people who have oily sensitive skin
What are
had
the
nothing
lighter
to
products? And we are at R&D, at our R&D place. We always discussed Koreans have cracked the hydration code.
Yes.
Because
So
the
the
layering,
products
light
are
layering.
mostly hydrating. Hydrating, moisturizing, soothing, from snail mucin to propolis, centella
Azelaic.
asiatica, from green tea extracts. All these are very soothing on the skin. So that is what they are aiming at, to not irritate the skin. So that is why they got into a market which nobody was making products for, for sensitive skin type, who cannot tolerate too many products, who don't have fragrance. So mostly they are hydrating and moisturizing.
But do you think that Korean products as it is can be are formulated for Indian skin and health?
So see,
Climate most of
Yeah,
all.
climate mostly.
so most of the products are okay. Like if you're using a moisturizer and a serum, that's okay. But overuse of products, having 10-step skincare routine, all that is not required for Indian climate at all.
That's
Because
what.
see, you have to see where Korea is located. You know,
Yeah.
the weather there is different. It's very dry, it's cold, while here it's humid. We don't need so much of layering of products. But if you're choosing like one serum or one moisturizer, it's okay. It might not be formulated for Indians, keeping Indian skin in mind, as in, they don't suffer so much from dark spots and hyperpigmentation like Indians do. But they still are very soothing on the skin, which itself helps in reducing dark spots, and helps in reducing acne. So that's why they are popular.
Because I feel people in India expect a lot of outcome like Korean skin. They expect Korean products or Korean ingredients to work the same way they do on Korean skin.
So
Because the
Keeping
health
the
and
Yeah.
genetics aside,
Yeah,
they
health
want to be the
condition
Korean.
is
No,
very-
so it is not going to look like that.
Yeah.
If you use Korean skincare, your skin still requires to be cared for in
Yeah.
a separate way, and it's not going to address all your problems. They have to be addressed properly. But yeah, Korean skincare, no harm. It does feel nice. If you like the way it feels, go ahead. If you have dry, sensitive skin, you're going to love using it. But if you have non-problematic skin, then you don't have to go searching for Korean skincare. You have to include it in your routine. No, it's not mandatory. But if you like using it, go ahead and use it.
Nice. And what's one skincare trend that you think is absolutely nonsense?
Face yoga and this vigorous massaging of the face, feeling that it will lift your skin.
Yeah.
Little bit of massage, go ahead and do it. It feels really nice on the skin. It will make you feel relaxed. Absolutely, go ahead and do it. But this vigorous massage, thinking that it's going to lift your skin, not required
With
at
those
all.
tools also.
Yeah, with those tools,
Yeah.
it can actually cause a lot of friction on the skin, irritate the skin, which is what we don't want. And so I think those are not required. If you want to do a little bit of gua sha, go ahead and do it if you feel that it's relaxing on the skin, if you feel a depuffs. But like a 30-minute massage
That's-
routine every day and all that, I think is not as beneficial as it's thought to be.
Yeah.
Correct. And what's one ingredient everyone should stop using on their skin immediately? Anything you can think of?
I would say essential oils. Don't use essential oils on your skin. And I would say irritating home remedies. Something like neem paste, lemon, orange, apple cider vinegar, orange scrubs. Sometimes
lemon.
people use baking soda, toothpaste on their face. So any kind of irritating home remedies, please don't use it
Doctor,
on
what do
your
you
face.
feel about, like, we have heard this a lot of times on Instagram, also on other magazines also, that people, whatever you eat, you apply it on your face. What kind of a myth is that?
No, don't do it.
Don't do it.
Just eat healthy. And see, if you
Yeah.
want to, so home remedies are big in India.
Yeah.
Whenever I say don't use home remedies, I get trolled a lot,
Yeah.
People love their home remedies and they don't want to hear anything against it. So if you want to use it, if you just want to relax, if you want some me time, go ahead and use it, but use something that is not irritating on the skin. Like you can go ahead and make a mask of banana, maybe papaya, watermelon, cucumber, potato slices.
Gram flour.
Yeah,
Maybe,
gram flour is
yes.
okay, but add a little bit of rose water in it. Avoid gram flour if you have sensitive or dry skin. Otherwise, you can go ahead and use it, not a problem. Even milk or curd or a little bit of ghee if you have dry skin, not a problem. But expecting home remedies to correct your skin concern and change, that's not right, because it's not going to penetrate as
45-minute
deep.
temporary plump that you get,
Yeah.
but it cannot correct.
Yeah, so I do get people, who say that, oh no, you say Multani Mitti doesn't work, but it works. I use it every day.
Yeah.
My God,
Makes
using
you
Multani
so
Mitti every
dry
single
like
day.
a rock.
Yeah, and also how much time are you taking out? Because
Yeah.
Multani Mitti takes at least 15 to 20 minutes to dry,
Dry
and then
down.
you're using it every day. It's so messy. Like, it's better to
Yeah.
use certain ingredients which are easier to use, better formulated, meant for your skin, rather than going
And
for
also
these
it affects
home
the
remedies.
barrier somehow if you
Yeah.
use it every day.
Of course. So Multani Mitti, it basically just absorbs oil.
Oil.
Okay, it just sucks oil out of your pores. So that's why people who have oily skin love using it, because they feel that the pores shrink, their skin instantly looks smoother, the blackheads, whiteheads, just looks better. That's what they
Instant
feel.
brightening
That's
technology.
what they feel.
But
yeah.
that's a very temporary fix. You can do it once in a while, but I would suggest that it's better to use certain ingredients that can help in controlling these conditions in the long time.
And give us 3 healthy foods for glowing skin.
So there is no food that you can take that'll give you glowing skin.
Yeah.
We have to understand that first. Anything that's healthy for the body is healthy for the
Just
skin as well.
betterment.
Yeah, so I
generally.
would say fresh fruits, salads, green leafy vegetables, nuts and seeds. These are good for skin and hair.
I have another question to that. People, a lot of dermats also, and a lot of doctors I've heard dietitians say, more the water you drink, the better your skin is. Is it a myth or is it just another fad?
It's a myth. So see, not more the water means how much of water are you drinking.
Like
You
eight-
don't need so much of water.
They
Okay.
say 6 liters.
Oh my God,
or
no.
8
You need
liters
two and a
or-
half, no, 2 to 2.5 liters of water. 3 liters is more than enough if you're somebody who's working out. So we usually say like 10 to 12 glasses a day should be enough. Okay, and also a lot of people feel that if they're dry skin, they need to hydrate more. No, that's not how it works. You have to use moisturizers which help in repairing skin barrier and locking the moisture for a long time. You can take omega-3 fatty acid supplements that helps in improving skin barrier. So just drinking a lot of water washes out toxins. That's
Yeah.
not true. Of course, you don't have to dehydrate yourself. Sometimes people drink not even 2 glasses of water in a day. That's not right. So you have to make sure that you drink at least 2 liters, 2.5 liters. That is roughly 10 to 12 glasses a day. But drinking like 4, 5, 6 liters is not going to add anything other than spending a lot of time in the washroom.
From this, can we have water?
Okay.
Next question is most trending on Instagram. Is oral collagen a scam or does it work? Everyone is putting up in gummies and claiming to do the magic overnight.
So I have to put a disclaimer that my opinions might be, coming from a space of bias, because I do see patients who are taking this who are not seeing any results. Also, it's biased because only patients who don't see results actually come to me. Okay, so I really don't believe in collagen supplements at all. Whatever studies are there are a few randomized controlled trials, but the kind of results that you show are so minimal. I feel that much can be achieved with just using a good moisturizer and taking a high protein diet.
Correct.
You don't need to take collagen powders or
Also, I
supplements
feel
separately.
There is a certain level of loading that can be done into a tablet or a gummy.
Tablets, gummy, to forget about that. Those don't work at all. I'm talking about these powders that they mix in, either milk or water and drink it. So see, there's nothing like a vegan collagen and all that. Okay, it has
correct.
to be marine collagen if it has to work. But I feel if you just take a good protein diet, that should be enough to help your body recover or get the collagen. Whatever studies that have been there, they have examined the skin with a magnifying lens, and they have found that it improves hydration of the skin slightly, improves elasticity slightly. This can be done with just moisturizers and
Moisturizer.
retinol. So there isn't a huge change as it is marketed, and it's quite expensive to take it
Yeah.
on a daily basis.
Very
It's not
expensive,
something
yeah.
that you can just start and stop
If you're
and you'll maintain
making
the
a
results.
good collagen in your production, that
I
takes a lot
feel
of
that
cost.
the cost that it comes
Yes.
with, I personally don't recommend.
And it is
This
insert-
view might change later, when there are more robust data or better
Yeah.
formulations which are more reasonably priced. As of today, I would say
Are
I don't believe in that.
injectable collagens also a thing, or that's also a
No,
very
no,
marketing?
collagen is not injected at all.
Okay.
I think at the end, if someone wants to go on that side, hyaluronic injections are there. Can you tell
Yeah,
a
so
little
those
more
work,
about that?
yes.
Yeah.
So those are called skin booster injections,
Yeah.
or even comes in filler. So hyaluronic acid can be used in different cross-linking with a different kind of viscosity for different requirements and for different indications. So there are certain skin boosting injections that we give where small amount of hyaluronic acid is deposited with very tiny needle just in the dermis, in the lower layer of the
Correct.
skin. So therein it attracts water and tends to hydrate the skin for a longer period of time. So it gives a little bit of a glow. Even as to the skin, yeah, that definitely works. That
A
can
lot
be
of
done.
people are very scared about these things. Can you tell them it's safe and it doesn't have any side effects? As
Yeah, so-
I think they go for a good 6 months, and you can
Yeah,
refill,
6 to
take
8
them.
months it
Yeah.
does work, and it gives a really good result. So especially somebody who has uneven skin tone or who has dry skin would really benefit from these skin booster injections. They are safe when you go to an expert and get it done. Make sure you're visiting a dermatologist, to get these procedures done. Yes, it is safe, and you will like the results.
I have one another question to that. Does the doctor also treat herself or with these treatments,
Of
or they're
course.
okay?
Oh, yes,
Okay.
yes. Of course, I do get skin boosted injections on my face.
Oh.
I do get anti wrinkle injections on my forehead and around my eyes. From time to time, yeah, all
And
dermatologists
is
do
there
it.
a particular age to, if, for example, I'm 29, if I'm scared I might get wrinkles here, when can I start?
Okay, see, so different dermatologists approach it differently. There is something called preventative Botox. I'm not a big fan. If you have hyperreactive muscles and if there's hypertrophy, and I can see that the muscles are overused, then you can use a little bit of botulinum toxin injection into that area to soften it. We don't want to freeze your face, but just soften it a little bit. That can be done in your 30s. Okay, and otherwise, other treatments depends upon your facial structure. What is your expectation from treatment? A little bit of lip filler can be done even in your 20s. That'll just give a little bit of hydration, kind of balances out your profile, makes you look a little, a more balanced facial feature. That's what we tend to achieve with fillers. There's no age as such, but yeah.
But they're safe for every age,
Yes,
whenever
they are
want.
safe. They are safe. Again, qualified professional, let
Of
them
course.
assess it and take a decision. Then,
But do you
if
think
done judiciously, it's fine.
earlier the better? Like if we go and prevent them from
Rather than
coming
cure.
rather than cure.
Okay, so
So
see, there is
Prevent or
something.
how
cure.
does it work? We very
Okay, so with botulinum toxin, we do have, a little bit of observation that if you start too early, then it tends to make you look a little more aged because the muscles become atrophied. The muscles become thin. Okay, so
Correct.
that can then make you look a little more aged. So I would not suggest you to overdo with botulinum toxin injections. You have to use it judiciously. If you feel that certain muscles are overactive, maybe you can just do those, and maybe even though the results last only for about 4 to 6 months, don't get them done before 8 months to a year. That is something that can be done so that the muscle action comes back, and then you again re-inject rather than going every 2 to 3 months to inject it.
so it's
So that
better
is
to
something
get
you
it
can
done
do.
when you see something on your face.
When we suggest that when you start seeing slight lines and wrinkles that remain on your skin, even when you are not moving your facial muscles, very slight faint lines, that is the best time to get it done, because that can be reversed and that can
Okay.
be improved.
But coming back to, for example, I want to get it done and experience this just for the experience sake once.
Yeah.
I get it done, and after 8 months, it gets faded away. Is it a loop to getting it done, or
Not
an
at
addiction
all.
to get?
No. So yeah. So this is a good question, because a lot of people feel that, especially not with Botox as much, but with filler, they feel that, oh no, when the filler gets dissolved or goes away, disintegrates, then will I look older? Will it make my sagging worse? No. You see what happens when a 40-year-old gets filler and Botox done. She'll start looking like 32, 33, 34. Okay, so you tend to look 5 to 6 years younger. Then when it fades away, you
You're again
will
back
look
at 40.
42, 43, but you're used to looking 35. So, suddenly they start feeling, oh,
That's
it
what
makes me
makes
look
you
worse.
get
It
into
makes
the
you look
loop
worse.
then.
It doesn't make you look worse. You just tend to forget what you looked before you got these treatments done.
That's
I'm
true.
not trying to encourage, and I'm
Of
not trying to
course,
say
Absolutely.
everybody
and
should go and get it done.
Everyone wants
Okay?
to look young at
I
this
think
point.
this
Yeah.
is a choice, complete
Absolute
choice.
choice. If you like your wrinkles and you embrace it, go ahead. But
Yeah.
there are modalities available if you want to embrace it. If there are modalities available if you want to correct it, so definitely do it judiciously with an expert, and you should be happy with the results.
Got
Can
it.
people do something like this for acne or adult acne? We've got so many questions on that. Like can they do something for acne or reducing dark spots or acne spots? Is there any treatment for that
Oh,
also?
absolutely. There are many treatments for acne, adult acne. So, see, you have to understand that adult acne is usually the cause is hormonal. So, we have to take a detailed, menstrual history, and also what all medications are they on. Is there something that is triggering it? Sometimes even, use of makeup, not using the correct skincare products could be triggering. So, all that has to be considered and taken into account, because hormonal acne or adult adult acne is not something that you can just apply some creams and it'll go away. Usually it requires oral medications also to be taken for about 3 to 6 months. But yes, there are lasers available which can reduce your dark spots and reduce acne. There are chemical peels which we prefer to do along with creams. So yes, there are multiple treatments available for acne and acne spots. So yeah.
And I think people, girls these days suffer a lot from PCOD. So this question also I've got a lot.
But we have
They
always
have-
been, whosoever DMs us on our Instagram page, that's the first question that we ask,
Yeah.
PCOD or PCOS, that please give us your history so that we can't just jump onto giving you a product.
Correct.
There might be a reason that it's causing from inside rather than any topical solution.
Yes, PCOD is on the rise, and a lot of young girls are suffering from it, and it is going under-diagnosed. So we have to understand what all are the things you have to look out for when we have PCOS. So if you've gained weight recently, there's something called lean PCOS also. So it's
Yeah.
not like only overweight women have it. And then if your period cycles are irregular, if you're getting periods less than 8 times in a year, if you're having increased facial hair, thinning of hair on the scalp, acne which is not getting better with topical treatment or oral medications, then we do suspect PCOS. You have to visit a gynecologist or endocrinologist or a dermatologist to get yourself evaluated. We do a hormonal profile, check your ovarian status, and then put you on certain medications. You have to understand that it's not something that can be cured, but
That's
definitely
what
can
I
be
was
Prevented.
controlled.
Yeah.
Yes, so lifestyle changes are number one.
Yeah,
Okay, so
so
first
what's
is
the major cause of
sedentary lifestyle, high carbohydrate diet, fast food intake. These tend to exacerbate it more. So being active, taking a high protein diet, reducing your sugar and carbohydrate intake can definitely help. And along with that, being on certain medications which can help in regularizing your hormones can also help, which obviously should only be taken under supervision. So yes, it can definitely be made better, but requires to be evaluated. So I would suggest every girl who is suspecting
evaluation
to
is the
please,
must?
yes.
And what about how harmful are these whitening creams available in the market? We were just discussing it also.
Yes, so I get a lot of patients even today. It's so disheartening who are using creams given to them by so-called doctors which are unlabeled. So they're using it from a dabba, or somebody's making something at home and they're using it. It has no labeling. We don't know what the ingredients are in that. That is like the most harmful thing you can do, because these usually have ingredients such as lead, which can cause poisoning, and
Correct.
also contain ingredients which are harmful when you use it on the skin in the long run. It can, for a short period of time, whiten your skin, but later thin your skin out, make it darker, land you up in a lot of problems, which takes years to recover. So please don't use any kind of whitening cream which is unlabeled, which does not have proper ingredients listed out. Yes, there are skin lightening agents, like there are agents which helps in reducing melanin production, but it has to be present in a concentration which does not kind of irritate the skin, in a concentration which does not kill the melanocytes. Some of the creams can completely reduce your pigment and leave you behind with white patches, which is not something that
That's
we
true.
want,
The
right?
idea behind Melaki was this only, that we want to take them from steroidal creams to a journey of patience but result oriented.
Yeah.
Because this hydroquinone, as I was talking to you
Oh,
earlier,
that should only be used with prescription and for a very
but
short period of
the
time.
question arises is, there was this client I had a word with. So a doctor prescribed her hydro for 40 days. But in these 40 days, she got so addicted, because at the end it is taking off a layer from your skin which is making you look brighter.
No, so what hydroquinone does is it reduces the amount of melanin production.
Correct.
So it makes you look lighter.
Lighter.
But it should absolutely not be used, because what it does in Indian skin is that over time it causes deposition of something called ochronosis. We call it exogenous ochronosis, so a deposit of certain agents in the deeper layer of the skin, in the dermis, which makes your skin appear darker. So initially it might become lighter, but over time you get like a mottled type of pigmentation, like white and black dots of sorts on the skin, which is very, very difficult to take care of. So please,
What
do
happened
not
with
use
her
it.
was, she was prescribed for 45 days and she got so addicted to
She
it, and she
continued to use
kept
it.
on using it for like 18 months straight. Hundreds of tubes, I don't know how many. And then now she's at a position where she can't even use a cleanser, because the sensitivity is at so much peak कि अब उन्हें कुछ भी सूट नहीं कर रहा है.
Yeah, so that is what we call a topical steroid damaged face. So usually these hydroquinone creams also have steroid, component in it. That's how they are sold. And unfortunately, we are really trying to, get strict regulations out so that these can be available only with prescription and cannot be repurchased without a prescription. But we don't have that in place as of now, so people are repurchasing it. Maybe your dermatologist has written it for just 6 weeks, they are using it for months, years, and lining up in trouble. So please, I would suggest everybody to do not use any kind of creams like that which are prescription based without supervision. It takes years to reverse it to normal skin. So this is called topical steroid damaged face, wherein we have to put you on many oral medications, put you on thick creams, a lot of moisturizers, only plain zinc oxide sunscreen in order to get your skin de-addicted. So it is a process.
And why is it there's so much obsession with fairness these days?
It's always been there. Actually, now I feel the obsession is less thanks to social media, thanks to, dusky actresses also, being shown on the big screen. Otherwise, if you look back in, earlier generations and decades back, we only had a certain skin type, a certain body type being represented, and everybody was held to that standard, and that was considered beautiful. So if you were of a duskier complexion, you were just made to feel lesser than. Though it still is prevalent today, but I feel it is much less now than before, and we have to embrace our skin color. We have to embrace it. We have to focus on healthy skin, on healthy skin barrier, on protecting your skin, on reducing dark spots, of course, but not, your aim and goal should not be to become fair. Your aim and goal should be to just get healthy skin and the best that is possible in the skin color that you have.
Absolutely.
It will take time, but I think it is changing. Yeah.
Still, there is a big portion of India, like the queries that we get, I'm taking from there, that the sole objective is the skin lightening, nothing else.
So
Do you think
a
brands
fairness
play-
brand is
Yeah,
behind
that's what I was
creating
about to
this
ask you.
insecurity. For decades they got away,
Exactly.
making really unethical kind of advertisements and doing this unethical marketing, which made it look like only the fair girls were getting all the best jobs, only the fair girls were getting marriage proposals. So I think that was so deeply ingrained. They were just playing with your insecurity that already existed, and they just took that and went with it. And so now, thankfully, the labeling has been changed, and now brands are more aware. There is certain type of marketing that cannot be done. So I hope now young girls start accepting this new trend that we have, that we accept what we are born with. We try to improve it, but we don't try to change it. Don't try to kind of chase a certain beauty standard that's not achievable. And we are redefining beauty standards now. When we think of a beautiful girl, there's not just one image in our head. There are multiple different images. That's how it should always be.
Improvising skin is not fair now. It's
Yeah.
healthy
It's
skin
healthy
now.
and
Healthy
happy
skin,
skin,
it's maybe like a little glowy, maybe a little moisturized.
What about smoking and drinking effect on the skin?
So smoking definitely makes your skin look more aged. Smoking is the worst thing you can do to your skin. It accelerates collagen breakdown. It makes you develop lines and wrinkles faster. So it causes premature aging. It also makes you develop hair loss faster. So these are the effects of smoking. So what smoking does is it causes vasoconstriction, means it reduces the size of blood vessels. So it reduces the amount of blood flow to the scalp, which makes your hair fall become worse, and similar effects are seen on the face as well. So definitely smoking should be
So I got this question, I think 2 days back. This girl asked me that I smoke a lot of cigarettes and a lot of weed, and my face is showing up now, my skin is showing up, and what do I do? So I told her quit maybe, but she said no.
Basically,
Give me a
they're
very
not-
practical,
So
practical solution.
quitting is the only thing to
Obviously,
do.
the
Other than
solution,
that, yes, quitting, and then you can use an antioxidant serum to kind of build in the collagen. Start using a sunscreen on a regular basis, so at least that UV damage that your skin is going to go through, that you're putting at bay. Use a thick moisturizer. Make sure that your skin is not dry. Trying to
Does
take those.
drinking water also help in reducing these signs of aging or whatever they're feeling their skin is
So,
showing
like I
up.
said before, drinking, yeah, 10 to 12 glasses of water, okay, but drinking liters and liters of water, is that going to change the way your skin looks? No,
No.
Exo- the major issue is if someone is not able to hold it in the bladder,
Yeah,
they will just be
I
sitting in the
mean,
washroom all day.
there is no point of drinking so much of water. As much as you require, 2 to 2.5 liters, good enough.
It's fine.
And many people say you shouldn't touch your face again and again.
Yes.
Why?
Because see, a lot of people have a habit of picking on their acne, especially when they are a little stressed, or biting their nails, and then that is going on the face. So of course, you are just transferring all the dirt, dust, germs that you have on your fingers into your skin. So touching your face again and again is an absolute no-no, especially for people who have acne-prone skin. So you have to consciously stop in order to break the habit. It's a difficult habit to break for people who are
Correct.
into it,
Yeah.
But yeah, that's the worst thing you can do to your face, like pick on your acne.
And they scratch their head and just put their hand on the face. That's the worst thing to do.
Yeah.
And we tell every acne prone person who comes to PT or comes to both of us for direct consultation, we always tell them don't touch your face, because that's the worst thing you can do. You're just putting germs on your face indirectly or directly.
Yeah, so and also one more thing, since you're talking about the scalp, is a lot of people don't realize that not keeping scalp clean could also be the reason for a
That's
exacerbation
true.
of acne.
That's
Correct.
true.
Okay, a lot of young boys have acne only on the forehead.
Yeah.
That and also have dandruff. But they are not washing their hair regularly. Or young girls, who are going to school, who are washing their hair only once in a week, which is just not enough to clean your scalp.
Correct.
Especially in the weather that we live in here, you have to wash your scalp at least 2 to 3 times in a week. So washing it regularly is very, very important in order to keep acne also under control. Changing pillowcases, keeping your face towel separate, all that are small things that can have a huge impact on how your skin
But
looks.
also there's a myth
So-
in the girls, correct me if I'm wrong, that washing your head after every 2 days can also lead to more hair fall.
That's a myth.
So
I
that is a
feel,
myth.
yes.
So see, you have to keep your scalp clean. So a lot of girls feel that they lose hair while shampooing. So that's why they avoid shampooing their scalp. But keeping your scalp clean is very, very important. Otherwise, all the dust and the oil that's produced by the scalp is just going to clog and make your hair fall worse. So it's a big myth that people feel that washing their hair regularly causes hair fall. You should absolutely keep your scalp clean and wash your hair at least 2 to 3 times in a week.
And if someone's working out or just going to the gym and they want to wash their hair regularly, like on regular basis, is that also normal?
That's
and
also
very
fine.
much fine?
If your scalp is oily, you can wash it, every other day. That is
Okay.
also okay. For men, you can even go ahead and wash it every day. Not a problem.
Okay.
If you have oily scalp, you can go ahead and wash it. Not an issue.
That's amazing. I have another question to the acne series. How much of an importance is your towel? If you're using something like a microfiber towel or a regular towel for your acne prone skin, like face towels, how does it make a difference for
So see, basically, I look at towel as an hygiene issue.
Yeah.
So it's not the reason for your acne, but it can make acne worse.
Worse, yes.
So your body towel and face towel should be different. If you're talking about the fibers, I would suggest go for something that feels very soft on the
Soft on
skin,
the
and always dab your skin and don't wipe. Okay, that wiping
Don't
motion
rub
can
the-
sometimes, that wiping or rubbing motion can sometimes irritate the skin, which can leave behind micro tears, especially if you're having acne. Your skin is already inflamed. Any kind of injury can trigger a dark spot. So in that case, just dab the excess water off, or you can even let your face air dry and just wipe the excess water off from the neck. So that can be done. But don't be harsh while dabbing your skin.
That's the only reason we introduced our Feel Me towels for acne prone people, especially because they're so soft on the skin, and they also don't have the residue of your detergents or whatever soap you're using to wash them. So they make, and we have got these reviews a lot that they're making acne prone skin better for people.
We never knew
Customers.
this was just a random launch, just because a lot of people, we personally use that product and we were like, let's test it as a limited edition product, that it's so good on the skin. So when we launched it, we had no idea. It's just at the end a towel. So it took approximately 8 to 9% of our total revenue.
Yeah.
So it just became so viral in terms of that people could see the difference on their skin because they were using those hard towels on the skin and it was causing a lot of rashes. And then switching to that changed
Using a soft towel definitely helps, and dab, that is important. But then sometimes, I see these people rubbing a towel on the face to kind of physically exfoliate the skin. Please don't do it. That'll only land you in trouble. So yeah, dabbing the excess water off is good.
One last question,
Yes.
just for the people who are entering into the dermatology field. How much does a dermat earn in India? What is the scope? We are not entering into your personal financials or anything, just to motivate
Yeah.
whosoever is entering into this field. What scope is there?
So let me preface this by saying that if you've entered into medicine thinking that money is the biggest driving force, don't do it. There are easier, better ways to make money than medicine. Okay, it has to be passion driven.
Correct.
Having said that, of course,
It's an 8-year thing,
this
5
is-
plus 3, right?
Yes, 5 plus 3. So, 5 plus 3. And then after that lifetime of working, reading, updating yourself,
Upgrading yourself.
upgrading, everything. Okay, so if you're thinking that, you're in it for the money, don't. Now there are so many opportunities that you can
But
explore.
considering it is one of the most
But
trusted
yes,
profession.
yes, but yeah, if of course it is important to be financially sound, financially stable. If you want a certain lifestyle, which we all do, definitely go for it. And dermatology, I think, gives you the best thing about dermatology is your work-life balance. You can have a good personal life as well as a good professional life, which unfortunately, very few medical professions can
Correct,
provide.
because of that emergency factor always on your head.
Yes, so this does not have emergency, so that is one of the factors that a lot of people are attracted towards taking dermatology. I would say, as a fresh pass out, you can earn between 1 to 1.5 lakhs. That is usually your starting salary per month, and then once you get into private practice, sky's the limit. Depends upon what skills you have, how good you are with patients, what you're able to offer. So yeah,
And also
there's-
reach out to n number of people through social media now.
Yes, now social media is such a good
Education
platform
platform.
to educate people and to guide them in the right direction. So I put out information on social media so that people stop making the mistakes that they do. They are more aware of
Because
their
of the
skin
skincare
and skin health.
experts that you had mentioned,
Yeah,
there is
so
a lot
also
of misinformation.
we need to counter misinformation. I suggest every dermatologist should be on social media. Every doctor should be on social media just to kind of counteract the misinformation that is there. If all of us are there giving right information, then people know whom to trust, which source to go to. So just for that reason also, everybody needs to be there.
US
so
has
that-
been very active. Doctorly, I guess, Dr.
Yeah.
Mujib,
Yeah,
right?
so US is very active, and now a good thing about YouTube in US is that they also have that one label that comes that it is from a registered medical practitioner. So they ask for degree and they verify that. And if you have a proper medical degree, if you're a registered medical practitioner with a licensed degree, then that labeling comes when you're making your videos. So then that's a trusted source.
इंडिया में
It's
तो
going to
मैम
also start in India.
90% इंडिया में 90% ब्रांड्स बंद हो जाएंगे अगर ये लेबल आ गया.
The thing is that there has to be clarity. See, I'm not saying that only dermatologists should talk about skin.
Correct.
You can talk about skincare products if you are using it on a regular basis, not a problem. But you cannot call yourself a skin expert. You cannot be treating one person, that is yourself, for acne, and then acting as an expert in acne and showing medications that are written in your prescription,
You can be
asking
an-
people to use those creams that a dermat has prescribed. That's not
Also,
the right
you
thing
can
to
be
do.
an enthusiast and share your experience, but you
absolutely,
cannot
share
be
your
an
experience.
expert.
Yeah, share
sharing.
your experience. See, acne can be sometimes a very lonely journey, especially if you are the only person having acne in your friend circle or in your family. Then you can feel a little isolated. You don't know whom to talk to. You don't know how long acne is going to be there on your skin. So of course, having a community definitely helps. So show them how you need to be patient, how you need to do the right thing. Don't avoid using certain things. That's okay. But posing as an expert and treating people's acne, I think it's taking things too far, because there are so many aspects that we need to look at. I also get a lot of queries about, they give me a detailed history and say, now tell me what a routine I can follow. It's not legal for me to give them the information without seeing the patient, without understanding, without checking the quality of their skin, what have they used in the past, what they have not, how their skin type is. Without understanding that, how can I just prescribe medications, right? So that's what I tell my patients, and they'll feel like, oh no, but we just want one cream to make this better, one cream to... No.
I saw this reel on Instagram of this influencer promoting isotretinoin. Just have
that
it.
is so harmful, right? So we as
I
dermatologists
think
are
that
really
must
trying to
be
raise
of,
awareness.
The West now, not
But-
here in India.
No, in India, some Indian.
No, in West it's okay. You know why in
West.
West it's okay? Because there nobody can get isotretinoin without a
Correct. It's a
prescription.
prescribed
There
product.
nobody can get retinoin without a prescription.
There it's
so there
available
you can
everywhere.
even discuss, immunomodulators, chemotherapy drugs. They can discuss that along with side effects. Here we cannot. Here people are just going to go to a chemist and start using the product. So it's so difficult because we have to self-regulate, So I also really have to stop myself from giving out certain information and naming certain products, because I don't want them to be misused. I don't know who's watching my videos. Is it a 12-year-old girl who's watching it? Is it a 16-year-old girl who's watching it? How do I know, right? And these are people who should absolutely not be using anything. Age is not a factor. Of something like isotretinoin should never, ever, ever be used without prescription. Okay, and that too, it should be only prescribed by a qualified dermatologist who understands the implications of taking that medication, what other medications you should use with it, not use with it, know the side effect profile, know what all evaluations have to be done. So that's why sometimes I feel, like skin is so trivialized. People take it so lightly, but yet we have to...
They end up losing it all.
And
I saw
think
this
wasting
influencer-
time, coming with
I think
severe
there should
scars.
be, you can just guide the Gen Z people. Why I am focusing on Gen Z people is because they're very interested in trying new things.
Yeah.
But at the end, it's your skin and your 2022.
Exactly. There's so much a feeling of FOMO when it comes
Correct.
to products. As soon as a new product is launched, everybody wants to try it, and then the next month something else they're onto. No, you have to treat your skin as a long-term investment.
It should
if
be
something,
just a CTM to start with for the Gen
just
Z
a
people
simple
to keep
routine.
it simple.
Keep it simple. Use it for regularly. Maybe one dermat visit once in a year, just to know that you're on the right track. If you have acne, of course, then you might have to go a little more regularly. Otherwise, just one visit once in a year, once in 2 years, also just to know you're on track is enough. At least you have the basics in place.
Right.
And then if you want to try a new sunscreen or a moisturizer, face wash, that's okay. But people with sensitive skin who have rosacea, I would suggest don't experiment with your skin, because then to undo all that harm takes a long time.
And people who can't visit a dermat, how do they just
Now
see
there are
the
online
signals
consultations
for rosacea and eczema? Because people do not know these terms easily and they get to know way later.
Correct. So if you have a lot of burning, itching, stinging sensation on the skin, you feel that whatever you apply on your skin burns your skin or stings your skin, or if you get very red very easily, then you have to
rosacea.
you have to rule out rosacea.
And
A
eczema.
lot of redness. Eczema, if your skin is excessively
Extra
dry, flaky, irritated, itchy, then we have to rule out eczema.
Got it. Thank you.
Okay, so we can't talk about Gen Z without talking about Tinder. So we'll be playing a game which is called Skincare Tinder, where you have to swipe left, which you don't approve of, and you have to swipe right, which you approve of. So I'll be saying 2-3 things and then use. So 10-step Korean routine. What do you think about
Left.
it? Left, properly left. Okay. DIY at home chemical peels.
Oh, left.
Left. Skin fasting.
Today's age of overdoing skincare, okay, right, but make sure that you use at least a moisturizer, like a light moisturizer.
Okay. Sunscreen pills.
Right.
Right. Oh,
But
they
you
work?
cannot depend only on sunscreen pills. So see, sunscreen pills are not actually like pills to, magically form a layer on your skin and protect you from the sun. No, these are antioxidants which reduces the harmful effects of the sun and also reduces sunburn. So these antioxidant tablets can be taken for a short period of time when you're expecting a lot of sun exposure. Not the one to depend on it completely. You have to use
It
a
can
sunscreen.
be a lifetime thing.
No. You can take it for a short period of time whenever you're anticipating a lot of sun exposure. It's not something that you need
Going
to take
for a
daily
beach
or
vacation
anything.
or something.
Yeah, then you
Good.
take it.
But
or
do
a
they
high
really
altitude
work?
trek. As a solo agent, no. But as an addition, especially on people who are very sensitive to the effects of the sun, who have something called PMLE, or get sunburned very easily, yeah, it does help.
All right. 24 karat gold infused skincare products.
Left.
Big time left. Okay. Hydrocolloid patches for acne.
Right.
Right? They work?
Yes.
Oh, amazing. How
So
does
see,
it work?
again, we need to understand on what type of acne it works. See, acne are multiple types and multiple
Right.
types of different lesions. So if you have like a red bump, then on that you can apply a hydrocolloid patch. It will help in healing it faster. But if you have like a whitehead, then on that if you apply the patch, it's not going to help. Or if you have like a pus
Yeah,
point, then
that's
on
what I
that
was
also you
wa-
don't want to cover it.
Pus acne or the adult ones.
Yeah, so
you
those
can't
are
have.
not going to go, or a nodule. If it's a small papule, yeah, apply the hydrocolloid patch. So what it does is hydrocolloid basically forms a barrier. So it just reinforces your skin barrier so that it potentiates healing. That's
Oh,
all it's
got it.
doing. So it
Alright.
heals faster.
Next in PT. Okay. Sheet mask as a daily routine.
Oh, left. Please don't do
Absolutely.
it. Is you're just creating a lot of waste.
Because people think they're hydrating their skin.
No,
and
just use a good moisturizer.
yeah,
You don't need a
that's
sheet
the
mask.
go-to. Using ice cubes for pore tightening.
Left. Okay, so see, this is in the center, not left, not right. You have to understand that if you want to use ice, wrap it in a handkerchief or a towel, and then you can use it. Better yet, you can do that, ice water dunk rather than using ice. Again, if you have sensitive skin, rosacea, if you have a lot of prominent blood vessels on the skin or dry skin, it is just going to make things worse.
Yeah, because I
applying
used
ice
to-
can make your skin more dry
Yeah.
and flaky. So you don't want to
She's
do
been
it.
through that
I have
personally.
been through that,
If,
and
if you
I
have very oily skin, people usually like to do
because
that.
doctors used to tell me to ice my face, and it just used to worsen my skin barrier.
It does.
a
It makes your
lot.
skin even more dry and irritated. So don't do it.
Okay, all right. Charcoal based products.
Left.
Why?
I think charcoal is one of those ingredients which had a little bit of benefit, and people just went with it and marketed it to another level. So see how activated charcoal came into the market. So activated charcoal is actually used for alcohol poisoning. Okay, so when somebody consumes like adulterated alcohol, then you put charcoal to absorb it. It absorbs alcohol. So you give it per oral and absorb it. People took that and started putting charcoal, as in it can then take out impurities, take out carbon dioxide, take out all your dirt from the skin and what not, toxins. It takes out toxins from the skin. Absolutely not. It doesn't do anything of that sort. Okay, so no. See, it's not a harmful ingredient, but the way it's been marketed as a hero product,
like
or
a
something that
detergent.
that is going to magically change your skin. No.
That's nice.
Left.
Okay, then we have another question for collagen. Collagen drinks for glowing skin.
Left.
Left. Okay. Ceramides for skin barrier repair.
Right.
Absolutely right.
I
because
love
I love
ceramides.
it.
Ceramides is that one ingredient which everybody can include in their skincare routine.
Nice. So we're done, and many
Time.
right swipes. I think. Yes. Let's go to
Next
another
segment is PT questions. When it comes to addressing pigmentation, how important is consistency in using products like Melaki? You've used it. What's your advice for those looking to see results?
So, consistency and patience are the two most important things when you're dealing with dark spots, hyperpigmentation. Our skin type is very prone to develop melasma. Okay, so that requires prescription-based creams. For maintenance, you can use creams with skin lightening agents. That is important. And what was the second part of the question?
Your advice, those looking to see results.
Okay, so I would say consistency, patience. Along with that, using a cream which has skin lightening agents plus strict sun protection. A lot of people are using many actives, even exfoliants, but they are being very casual about sun protection. So then you are just not going to see results then. You have to use sunscreens regularly, religiously in order to see results.
Even if they're indoors.
Even
if
when
they're
indoors, even if you think it's minimal sun exposure,
Yes.
at least one layer in the morning is very, very
Right.
important when you're dealing with dark spots.
Dark
Correct. Moreover, if we focus more on the preventing anti-aging, the aging factor, I think sunscreen would have more importance. Otherwise, there's protection and everything. People are reluctant and very lazy about it.
Yeah.
When we focus more on the aging factor, they immediately take it up.
Yeah, but sunscreen is also, for reducing tanning, for giving you a more even skin tone, for reducing dark spots, for everything. Not just aging. Also the thing with, the skin type that we have in the Indian subcontinent, we are not very prone to develop the kind of wrinkling that Caucasian skin develops. Their
Correct.
skin is very... what do you say? Their skin just becomes very leathery with sun exposure, and the cumulative sun exposure can really damage the collagen. In our skin is not to that grade, because the melanin protects it. So using sunscreen rather than just preventing lines and wrinkles, of course that is important, but also maintaining the skin tone is very important. When we think of aging skin, we only think of lines and wrinkles, but
Correct.
no, when somebody has an even skin tone, that really makes the skin look much more youthful. So that is how they are playing with makeup, right? Whenever somebody puts makeup, why do they just instantly look brighter, better, and younger? That's because the skin is more even. They are not reducing your lines, they are not reducing
Right.
wrinkles. Your
Correct.
sagging is the same, your folds are not changing, but because the way light reflects has changed, it suddenly makes you look younger. So that's why skin tone maintenance is quite important. Like, you want even tone and you want light to reflect a certain way in order to for your skin to look youthful.
Absolutely. Second is Mucin Moist Serum has become a go-to for hydration. In your opinion, what makes it stand out for dry or compromised skin, as it has niacinamide, ceramides, snail mucin, and 9 kinds of hyaluronic acids?
Yeah, so I personally really like Mucin Moist.
Thank
I've
you.
told you that. Because of the way it's formulated, it feels really light and nice on the skin. Sometimes, what happens with hyaluronic acid serums, it tends to pill. And it tends
Becomes
to...
sticky also.
Yeah, or makes your skin feel a little dry after some time. After initial moisturization, which does not happen with this. So, yeah, it's a really good product if you can use it with your your active agents, over any kind of serum that you're using in the morning. Use this serum on top and then use a moisturizer. I also like to use this at night, or on days when you feel that you need that extra hydration and moisture. Use a layer of this Mucin Moist and then go ahead and apply a layer of moisturizer.
And
Works
what
well.
we do is, why we recommend it over a toner or a damp skin. If you can explain the absorption of hyaluronic
so
acid.
hyaluronic acid should ideally always be applied on damp skin, because hyaluronic acid is a humectant.
Correct.
What hyaluronic acid does is it draws water from the lower surfaces of the skin on the surface, on the upper
Surface.
layer. Okay, so if you put it on damp skin, the moisturization is just longer lasting and better.
Correct.
And also one thing is that if you have very, very dry skin, then just using hyaluronic acid is not going to help you. You have to use hyaluronic acid along with ceramides, either shea butter, cocoa butter, or
Yeah.
glycerine, and also seal it with a moisturizer. That way you get the best
Retain the
results.
moisture.
Yeah.
Are these specific signs, are there any specific signs that indicate a product is working well or not suiting someone's skin? How should users respond to these signs?
So see, the product working well would be if your skin is slightly looking better. In the first week, you will not notice much. It should just look a little moisturized, depending on what product you're using. The most important is to know if you need to stop using the product. So if it is making your skin appear red, irritated, itchy, you are having burning or stinging sensation lasting for more than 20 to 30 seconds, then that means the product is not suiting you. Sometimes active ingredients like vitamin C can cause a little bit of stinging, which is okay if it lasts only a few seconds. But if it's lasting a long time, then definitely you need to consult your dermatologist and see, maybe change the product. What can you do in the meanwhile is stop using the product, use a bland moisturizer. By bland, I mean a moisturizer which does not have color or fragrance in it.
Correct.
Okay. Nowadays we don't have moisturizer with color, but before we used to have this pink color
Correct.
moisturizer. So yeah, something without fragrance in it. Just use that, and use a sunscreen with zinc oxide. These two things will help in moisturizing the skin, reducing the irritation, and also protect from the sun. What happens when you use something irritating is that it also makes your skin more prone to develop damages from the sun.
Yeah.
Correct.
Okay, it looks like a red spot, but then you go out and you come back and you feel like, oh God, now it's looking darker, and that dark spot is remaining for weeks. So to prevent that, you can use a physical sunscreen.
And what about the retinol? What's your take on retinol?
Oh, I love retinol.
Same.
I love retinol. Retinol is one ingredient that has, robust data to support its efficacy. Also, this is one ingredient, which people have just taken and ran with. Retinol has to be formulated in a proper way, in a proper concentration. Retinol, propionate, palmitate are not as effective
These
as
are just
retinol.
claiming retinols, but real
Yeah.
vitamin A.
Yeah,
we
vitamin
have-
A is amazing for the skin. Absolutely, go ahead and use it.
Her skin doesn't support it at all, and
Mad
I
about
can't
retinol.
sleep
Yeah.
without it.
So I was about to ask you one thing. We have formulated vitamin A with bioplacenta. So that has worked really well for sensitive skin also.
Yeah.
That they have this formulation जिसमें उनको वो suit कर गया है.
Yeah. So just addressing that concern of retinol not suiting you, a lot of people feel that retinol has to be used every day. So then that overdoing and irritation tends to make things worse. Use retinol very very slowly. Start with once or twice in a week. It's something that you are going to use lifelong. So there's
Right.
no point being over enthusiastic about a retinol. So use it. Use a layer of moisturizer, then use a retinol and moisturizer. Follow the sandwich technique, and you will be able to tolerate, you will be able to find a retinol that suits
Yeah.
you. It
For
just have to be
example,
very small quantity and go slow.
I've been using Backshift, which has 0.2 percentage of retinol, vitamin A, along with Metrixyl 3000 and Malus Domestica. So now I feel it's been 6 months. Want to do better, wish to do better. When is the right time to shift from 0.2 to 0.5?
After 8 to 9 month mark, like you said, after 6 to 9 month mark is a good time to shift. And I also feel there's no reason to shift. If
I
you are
feel I am
tolerating
at a
something,
30-day run.
no
already.
need to always keep graduating, because higher percentage does not mean higher efficacy.
Correct.
You might really, you might tolerate 0.2% really well, and you might react to 0.4. What's the point of graduate? If it suits you, just continue it, not a
And
problem.
would someone like me who has like supremely sensitive skin can tolerate 0.2%
I would say no. You should first start lower, and a combination with maybe a retinol that is combined with a ceramide, something soothing, and something with a ceramide or a hyaluronic acid, and then use a layer of moisturizer. The technique of applying is also very important.
Yeah,
Retinol, use only pea-sized amount. Okay, 2 or 3 drops if it's in a liquid formulation, and if it's a cream formulation, just a pea-sized amount should be more than enough. And with retinol, the areas which it gets irritated the most are the curvatures of the face, like the folds, sides of the nose, this area,
And the
here.
under eye,
Yeah.
right.
So these are areas that you need to protect with a Vaseline petroleum jelly. So use petroleum jelly in these areas, under the eyes, corners of the nose and mouth. Then you will be
Nice
able
hack.
to apply retinol and be able to tolerate it.
I'll surely try now. That's his favorite
That is
product.
one ingredient I would say, everybody should go
Yeah.
back to it again and again,
Yeah.
and try to somehow find the one that suits you, because
In the
it'll
day,
really
I make
change
sure
your
I
skin.
use Mucin Moist, but at night, there's nothing
Nothing
which
like
can
retinol.
stop me from going to retinol.
Back shift, yes. Okay, so we'll start with some fun rapid fire questions now. Quirky questions only. One skincare product you can't live without. I am assuming retinol now.
No, moisturizer.
Okay.
Yeah, I have dry skin. I have very, very dry skin.
Okay.
So, yeah, one product would be
Then we are
moisturizer.
surely gifting you Skin Dam. You have to try and let me know. You love it. Okay, you are a night owl or early bird?
Early bird.
Oh,
I
that's
love my
amazing.
mornings.
Just very contrary to both of us.
Yeah, I know. And you know what? I used to be a early bird all my life, but once I shifted to Surat, that city is a night owl. Everybody's up till late. So in the middle for 5 to 6 years, even I used to stay up till late. But I am the happiest and the most excited
In
the
mornings.
Wow. I aspire to be one of those, but I it just
But I
doesn't
am
get
somehow.
to me. Yeah, we'll see. One ingredient you secretly love but don't recommend it often.
Why would I love and not recommend you? I mean, like misuse.
Yeah,
I love
exactly.
tretinoin, but I don't recommend it.
Tretinoin, right?
I love it, but I don't recommend it to everybody, because it
Risky.
has to be used. It's risky. It has to be only used with a prescription and under supervision.
Right. And I think you can tell the reviewers also, whosoever watches our podcast, that they should not promote 5% retinol on their reels, because a lot of young girls are also watching their reels and it's not safe for
Yeah,
the
it was so
skin.
disheartening to see,
Yeah.
an influencer with over 1 million followers asking
Yeah.
her subscribers, followers to use adapalene under the eyes for milia,
That's what.
tretinoin under the eyes. Come on,
Yeah.
like I think we need to have a little bit of.
Best.
Generally,
But
a
I
lot of Gen
think-
Z people are consuming that content.
No, you should not take any of this vitamin A other than retinol and retinol casually like that and use it without prescription, because you have to use it correctly.
One skincare step people can skip.
Toner.
Oh, really?
Yeah, people love doing this cleanser, toner, moisturizer, toner. So see, if you are somebody with oily skin, acne prone skin, you can go ahead, use a toner. If you are somebody with dry skin, you don't really need a toner. I don't think toner adds much to your skincare. No.
But-
Now, of course, there are some hydrating toners which can help in, repairing skin barrier a little bit, maybe just soothe and calm your skin. If you want to use a toner, I usually tell people use something with either a green tea extract or something with rose water or something with galactomyces. But
You generally named one of our toners. So what we have done is mix Centella, Equixil, and the
green tea, centella,
extract.
yeah.
Green
So
tea.
those are still okay, if you want to use a toner. But I am not a fan of toners at all. I think it's a
Very basic step.
that you can totally skip.
Skip.
Okay. So, tea or coffee, which is worse for your skin? Both?
Actually, both are not bad if taken without milk.
I love
I would
both.
say
Nice,
worse
yes.
would be chai, because chai usually has a lot of milk
Yeah.
and also sugar.
Sugar, yes.
So then that milk and sugar ka combination, no, especially if you have acne, can really trigger it. So the milk sugar combination is problematic. Otherwise, you can drink your green tea, you can have black tea. That's also okay. And even caffeine, not bad when taken in moderation. So I'm talking about like 1 or 2 cups. I'm not talking about like 10 cups. There are a lot of people who go to meetings, multiple meetings, and they can't say no when they're offered. So even under social pressure, they have to continuously drink tea and coffee.
That's me.
No, don't do it. It'll really dry your skin out. So that is, and also dehydrate you. It makes your
I
skin
don't
dry.
take sugar,
dehydrates.
but yes, there are
Yeah.
multiple
So
times
no,
that I'm
2
having.
cups, okay. And milk and sugar, try to avoid, because that combination, even on a cappuccino, if you're putting a lot of sugar and milk latte, that
Chai is their
combination-
first love. Chai is every Indian's first love.
Yeah,
How
that's
do
what I
we
tell
make
people.
it
Chai
happen?
is good for the soul, not great for the skin.
So true. Okay.
I can't open my eyes without a masala chai.
Okay, why it's not good
So
for
see,
your skin?
chai as such, I don't have a problem with. Like I said, the milk and sugar, the combination of milk and sugar. So milk tends to trigger something called insulin-like growth factors, in the body. That again stimulates the oil-forming glands to make more oil. So it makes your skin more oily and more acne-prone. So people who have a lot of acne, I usually ask them to avoid milk and sugar. Everybody is going to come after me and say that, how will I get my
We
protein?
love our chai.
Yeah, we cannot stop it. So I'm not making it a blanket statement to avoid it completely. I'm just saying that with people who are suffering from acne, which is not getting controlled with medications, trying to reduce dairy and sugar can markedly improve your skin. You can always consume something in moderation. See, I am somebody with a sweet tooth. If you ask me to stop sugar completely, I'll probably be like a grumpy old lady, So take things in moderation. Be aware of what you're consuming. That's all. See, we have one life to live.
Correct.
If you like something,
balance
like you
out.
said, like you love chai, why would you want to deprive? Deprivation never works out in the long run. Just moderation and being aware of your choices is what you can do.
Nice.
Nice. And चाय कॉफी हो गई, but alcohol की बात नहीं की. तो alcohol का skin पे impact. How
Okay,
is it?
so alcohol now has been classified as a carcinogen. So even the smallest amount of alcohol is not good for the body. It is a toxin. Previously it was believed, which is the myth has been busted many years back, that 1 glass of wine is good for the heart and alcohol
Yeah,
correct.
helps
Skin
in
also.
improving heart health. Absolutely not. There are better antioxidants that are available, and in which which you can consume, flavonoids that you can take, but you should not be consuming alcohol at all. That is what I would say as a doctor. The right advice is 0. The safety level
Tell
is
us
0.
as a human now.
I am scared to
Yeah.
ask
Behind
more
the
on
cameras.
Yeah, I would say 0.
Okay. Negative. Facials or chemical peels?
Chemical peels always,
Okay.
but again, see, it has to be done correctly under an expert. Chemical peels can really transform your skin. That is one procedure which is very reasonably priced, which can give you the maximum benefits. So if you ask any dermatologist, they would say chemical peel is their favorite kind of procedure to do for patients. The cost and the benefit ratio is extremely minimal. The benefits are very, very high for how much it costs. So yes, chemical peels are really, really good. Also, no need to overdo it.
But what
And the
about
right
these
peels have to be
products
used.
available in the market to do it at home?
Don't
That
do
is
it.
not
No.
recommended, right?
Absolutely not. Don't do all these home-based chemical peels. Please don't do it, because this Ordinary actually got this entire AHA BHA combination
Yeah.
into the market that might suit Caucasian skin, where they do not have dark spots, or they do not pigment as much as Indian skin. Our skin type, in the Indian subcontinent, if our skin is irritated, it can leave behind a dark spot that takes months to lighten. So don't do these home-based peels. Please go to a professional and get it done.
Nice.
And how often can it be done?
Depends upon your skin and the reason why you're doing it. There are multiple types of chemical peels. Some can be done just for a little bit of glow, some can be done for gentle exfoliation, some can be done for acne, some can be done for reducing fine lines and wrinkles. So there's a huge range.
Moving on to men's skincare myths and truths. As you know, it's the most hardest and the easiest sector to have, because we men hardly care about the skin. So we'll do some myths and truths. Is it true that men's skin ages slower than women's?
No. So see, they have looked at the structure of men's skin and how they age. I think it's more hidden because of facial hair. It's not very prominent, the sagging. So that's why we feel that they age slightly better. But in studies, we've shown that because of excess sun exposure that men have as compared to women, they also show signs of aging. I just feel that I've said in a podcast before that aging is very well accepted in men. We accept those lines, wrinkles. We think it adds character. We think it makes them look accomplished. But in women, the same things we don't accept as a society, as liberally. I think we put a lot of pressure on women to look a certain way. That's why probably. And also now, because men keep facial hair and beard and mustache, that tends to hide a lot of their nasolabial folds and sagging in the jowl area. So that probably makes.
And
Tends to
also,
make them
on a
look younger,
contrary,
but
men love white hair.
yeah, no, I don't think men love white hair. I'm sure women also would love white hair if they were allowed to love it. Yeah, in the middle, I had stopped coloring my hair for some reason, out of laziness, and my God, the amount of comments I used to get. Yeah, so no, people don't accept it, but yeah, I'm sure it'll change.
And what's one thing that can start men taking care of their skin?
How
at
important
least?
it is.
Oh, it's very important, and I will tell you why this has occurred. In the past, skincare products used to have a feminine fragrance.
Yeah.
They used to always have a little bit of perfume. So whenever they
Also the
wanted
colour.
to, the color
The
and
pink
also
tones.
yes, and the perfume always made it. It was marketed as, and people felt that it was a feminine product, that only females have to use it. But now, thankfully, a lot of men are also into skincare. They want to understand their skin. Also, there are not much sources available out there to kind of guide them.
Also, we were discussing this earlier also, that it is somehow brands' fault also,
Yeah,
in a
that
way
we are only putting
that
female
they've
faces
always
for
been focused
skincare.
on
Yeah. And
these.
men tend to feel that the products are separate for them. No,
Correct.
the products are the same. Men and women can use all the same skincare products. Not a problem at all. Just use the same skincare products. When a man enters my clinic, there is a certain difference in prescription. I usually tend to write lesser number of products because I know they are not going
They're
to
not
use
going
it.
to use it.
I usually tend to write multifunctional products because they don't want to layer too many products. They don't want to give it so much of time to their skin. So that is the one thing. And also, men tend to have thicker skin and have blackheads. So salicylic acid in a higher concentration maybe is preferred in men as compared to women. So few changes here and there, but otherwise men and women can use the same skincare products. Not a
Initially
problem
at
at
PT,
all.
we used to, when we used to promote gender neutral skincare, so people used to message us कि ये लड़की वाले भी और लड़के भी सेम चीज कैसे यूज कर सकते हैं.
बिल्कुल यूज कर सकते हो. स्किन सबकी सेम ही होती है. जस्ट दैट men tend to have thicker skin.
Correct.
And more larger size of oil forming
And
glands.
I think हमारे मल्टी डायमेंशनल प्रोडक्ट्स भी हमने मेन को मेन सेंट्रिक रख के ही बनाया. लाइक सन स्टॉकर आई वाज टेलिंग यू अबाउट, that is something जो बहुत on the go product है, like our other cleansers also. And men, I feel, they don't have the tendency to buy on their own.
Yeah, and also
Women buy
because
for
all the
them.
marketing is done on women, you know. So if you show these products being used by men,
Yeah.
they will feel that yeah, they can also use
You know,
it.
when we
That's
were
true.
collaborating with Athya Shetty, we had finalized. Then our PR team came up, ki why not KL Rahul also? We specifically had to take him on board just because that men should know that till
Yes.
that
It's a
time
gender-neutral brand,
95%
yes.
of the people didn't know that PT is gender neutral. The moment KL Rahul came up and used the skincare, our percentage of men from 4% went to 17%.
Yeah, that really
So
helped us.
basically, yeah, you need to let it be known that even men can use all these products.
And also, I feel somehow women are buying for their male family
Yes,
members,
for their brothers, for
and
their
yes, for
husbands,
their
yes.
and they only are asking them to use the skincare
Correct.
properly.
Yeah, it is.
And वो है वो education का थोड़ा सा there's
And men don't care about their blackheads. You know, the first time they start caring about it when they have a girlfriend. And the girlfriend points out.
This was the
Okay.
next question, that if a
So-
girlfriend has to gift his boyfriend a skincare product, what should she buy?
Cleanser. Start with a cleanser. Oh my god, you know, don't use
Start
your body
with face
soap on your
bath.
face. Yeah. Just
Really?
start with a cleanser. A lot of people are just using soap on their face. Start with a
Soaps?
cleanser. Cleanser and a sunscreen. Just start with that. Then
Yeah.
we'll see. We'll build up after that.
Does stress and testosterone levels make men more prone to acne?
Yes. See, acne, the incidence in teenagers are same between men and women, but females tend to seek treatment earlier. They are more bothered by their acne. But men tend to show worse scarring because also the reason that they
The
seek
major pits that
yeah,
get on
because
their
they
face.
seek treatment much later when it's already formed scar, and so that is one change. Otherwise, yeah, there is a role of hormones in acne, and yes, it does make
also they're
men
very
have worse looking acne.
they go in the dust a lot, they're outdoors a lot,
Yeah.
so they have
That also
they-
tends to, and also they don't take care of their skin. So that's why I said, at least a face wash. So start at
Yeah.
night time.
At least a
People are not even
sunscreen
washing
and a
their face before
cleanser,
going to
yes.
bed. That moisturizer and sunscreen, if you do this much, is enough.
yeah.
And this comes to, do oily skinned men still use a moisturizer?
Yes, absolutely. You just need to know which one. Use a light
Gel-based.
gel-based moisturizer, something with like a hyaluronic acid, or something with a ceramide in it, which does not feel sticky or heavy on the skin. Go ahead and use it.
Are charcoal face washes actually beneficial, or you just covered this, but I want to add this because men don't care about the skincare as such, considering. But what happens with a charcoal face wash? I used this X brand's famous face wash back in time, 6-7 years back. So the idea and takeaway as a man was, when I used that, it took off all the oil, excessive, not just excessive, all the oil from the face, and that feel of tightening on the face encouraged me to use it again and again. And there came a point where I said, I am not able to stretch my face because it feels so dry that it just took off the barrier.
So see, why do they market charcoal face wash only for men? There is a reason. Because they want to get you hooked from the get-go, and also they expect instant results. Women in general are more patient by nature. So even if a product takes time to work, they will still give it a fair try.
Correct.
Men will not do it. They are too objective. They just want results. Only that can drive it, drive
Right
the
away.
sales. So instantly, if you're using something that can cause exfoliation and reduction in oil, you will be able to notice that your skin is not looking oily anymore, and that makes you feel that it's giving the results. But no,
The
there are
instant shine
better
is good
products
to
in the
go.
market now. Thankfully, that is very reasonably priced, and you can get much better results.
So do you think कि charcoal mainly men market को cater करने के लिए बना था? Because I don't see any black products in the women
हाँ,
skincare
बिल्कुल.
market.
Yes, absolutely.
कि
Because
that
this-
takes off the feminine touch.
yeah,
from
because the packaging is black, and that just makes it less feminine, and that's why also they have targeted men more. Yeah, one of the reasons.
Correct.
The color.
And what's the deal with anti-aging products for men? Do they actually work? And
Of course.
when should they generally start, and with what ingredient would you
I would
suggest?
say by 25. So you see, sunscreen you have to start as soon as possible. You can start using a retinol after 25 years of age. You can add in a peptide about 30 years of age, 30 to 35. You can even use an EHA, an alpha hydroxy acid based cream about once or twice in a week after 30s, because 30s is when your cell turnover goes down. So you want to use certain ingredients which can replenish that and also boost collagen synthesis. So that's what you can start.
And I think as a man, the most important problem with us, including me, is the under eye bags, because we are so occupied into different things and exposed to more to sun, and under eye gels usually don't work to a certain level, just maybe for hydration purposes. Mainly every under eye is working on the hydration purposes, and with the new trends I saw a few brands using retinol in the under eye, as it's a very sensitive skin area. What's your call on that?
You can definitely use retinol in the under eye. It just has to be formulated in a correct way and applied very slowly in a small quantity, and go slow with the retinol in the under eye. Definitely it helps in improving the skin quality in the under eye area. So see, puffiness under the eyes are very difficult to treat with just topical creams.
Correct.
You have to understand what is the reason for the puffiness. If there's just mild puffiness, that gets better throughout the day, then reducing your salt intake or using under eye creams with caffeine, that can help in improving.
Correct.
If you have very mild puffiness, sometimes injecting hyaluronic acid based filler in that groove to kind of mask that can help. But if you have prominent outpouching of fat, not just puffiness, which is usually seen after 50-55 years of age, sometimes earlier, for that no cream, no treatment can actually help. Then surgical removal of that fat outpouching is the only option. So we need to understand, what stage it is, what type of puffiness it is. Usually the kind of puffiness that you have in your 30s or early 20s does get better with using a little bit of caffeine based under eye creams and trying to reduce your salt intake.
For example, as you can see my under eyes, the hyaluronic suggestion would be when?
No,
I was exploring
yours is
this.
very mild. Yours are very, very mild kind of eye bags that you have. I would say just depuffing maybe with a cold spoon in the morning, that can also help, and using a caffeine under eye cream, that can also help.
Got it. And the main objective for acne, for in case of men, has always been head. So hair, the dandruff. Can you take us through that? Do men need a different scalp care routine than women?
So not a different one. It's just that men are more prone to develop dandruff and oily scalp. But the scalp routine remains the same because they keep their hair short. They can wash their hair more regularly. And if you're somebody who sweats a lot, exposed to dust, more often, then you can even wash your hair every day, every alternate day. One thing I would suggest men to not do is just wet their hair and leave it. If you're going to wet it in shampoo, use the shampoo so that your scalp is cleaned. Okay, don't just wet your hair every day and then you shampoo only once or twice in a week. That does more harm than good. It can also make your hair more brittle. So if you are going to wash it with shampoo, clean the scalp. Or else
And
you
I
can
do it
shampoo
every day. Is that fine?
That's also okay. Yeah, just use a mild shampoo.
They'll not lose more hair.
Not at all. Keep your scalp clean, not a problem.
Nice.
See, if you have oily scalp, you will have to wash it regularly.
Correct.
If you keep it short, if you're somebody who works out on a regular basis, if you sweat, you have to keep your scalp clean.
But it's good. The sweating is good for the skin, right?
Yeah, in the sense that sweating is good for skin, but then that activity is definitely good for skin. Like working out is definitely good because it improves blood flow to the skin, and there is only good impact of exercise, whether it's cardio, strength training. This has a positive impact on your skin, hair, on your overall health, on your mental well-being. So absolutely, exercise should be an important part.
Next question is, can frequent hairstyling, gels, waxes, heat tools cause skin issues?
Not skin issues, but it can definitely make your hair dry and brittle, especially heat styling. So see, gels and styling creams form a coating on the hair strand, and they don't actually penetrate into the hair shaft or do any kind of issues on the scalp. So when you wash it, it comes off. But heat styling can cause damage. So even if you are into blow drying, just make sure that you keep it at least 6 inches away from the scalp so that it is, there's not too much of heat coming there, and make sure that you keep moving it so that only one part does not get a lot of heat, and try to, even if you want to style it with a blow dryer, use it only when it is at least 80% dry, for just the last 20% you are trying to style it, because when it's completely wet and you're trying to dry it, you need a lot more heat. So yeah, in terms of hair shaft, it can make your hair look a little frizzy, make it more prone to develop breakage.
And how does balding impact scalp health? And can it be prevented?
Balding? Yeah, balding can be slowed for sure. We can slow the process of balding by using certain lotions which improve
Main
blood
is the
flow to the
crown
scalp.
area men face with the starting.
Crown as well as the receding hairline. So that can be slowed. The process can be slowed by using lotions with minoxidil, which can help in improving blood flow to the scalp, and this tends to make thinner hair thicker. This has to be used regularly.
And
at
again,
least for 3 to
minoxidil
6
is
months
again
to see result.
prescribed product.
Yes.
Correct.
Should always be used with prescription.
And what's your call on Redensil?
Oh, that's also a good ingredient. So I prefer Redensil in those who are having hair fall. I feel peptides work really well in reducing hair fall and also for maintenance of hair. But in male pattern hair loss, minoxidil I think scores higher. In when you are having hair fall. For that, yeah, Redensil peptides.
But considering the studies that have come with the side effects of minoxidil, so people
Like
are more. The skin cancer study recently came. No?
Minoxidil has been in the market for many decades,
years.
and it's a safe ingredient. You can absolutely use it.
We've
without
been making
problems.
it since 2016, but again in the cosmetic side of the business, minoxidils are not promoted at all.
No, minoxidil is a prescription-based.
Prescription
It's a
product.
pharmaceutical product.
So, doctor, we would like you to create a PT vanity care kit, which we will give to one random follower of ours. And please tell them whatever you like about the product and whatever you have used from personal touch, very organically, very.
Yeah.
Yeah.
So I like this one, the Seta Bath. So this
Yeah.
would be a cleanser. Then I would follow it up with this serum. I really like the Mucin Moist. And then I like the Melaki, which I can't see here.
Yeah, it's not
Melody is
here.
not here.
Yeah, I
Yes.
like that because it's a combination of skin lightening agents where there are multiple ingredients to act on different level. So when we talk about dark spots and dealing with pigmentation, we can't just use a single ingredient and expect it to do magic. Usually we like to have a combination of ingredients which work at different level in order to see
And
results.
complement each other.
Yeah, and which synergistically act in order to show results. So yeah, Melaki is one of my favorites. So that and the sunscreen. I would
Sunscreen
add.
is-
That's in your bag already. I
Yeah.
guess.
So I would
sunscreen
say
is in
these
your bag.
these 4 would be in the vanity.
So Mucin Moist serum, Seta Bath cleanser, Mucin Moist sunscreen, and Melaki.
Melaki.
Four of them.
Amazing. So we'll give this to one of our followers and Dr. Aanchal followers.
The question will be in the end of the video.
Yes.
So how was your experience with PT? And let's wrap this up. Any last words, ma'am?
Oh, I had a really good time, and I'm so glad that we discussed many topics that that we haven't touched upon before, and a lot of people have misconceptions. So I really like the myth busting as well, and we also covered men's skincare so that they also start using products on a regular basis. So yeah, I hope the viewers will also find this informative.
Yes. Thank you so much for
Thank you so
coming
much.
and
For
giving
having
us
me.
your time. Thanks a lot.
For our very first episode of PD
Yes.
podcast.
Thank you for having
Thank
me.
Thank you.